Hello, everyone. Welcome back to Dream Speak English. I'm Sarah.
And I'm Jack. Today we're going to talk about something very important, how to talk to doctors in English.
That's right, Jack. Going to the hospital or clinic can be stressful, especially if English is not your first language.
But don't worry, we'll teach you simple and useful English phrases to help you communicate clearly with doctors and nurses.
Whether you're visiting for a checkup, feeling sick, or need to explain your symptoms, this video will help you feel confident.
Let's start with some basic questions doctors ask. Sarah, what's the first question a doctor usually asks?
Usually, the doctor asks, "What's the problem?" or "How can I help you today?"
Great, so if you're feeling sick, you can say, I have a headache, or I feel tired.
Or you can say, "I have a stomachache," or "I'm feeling dizzy."
Let's practice. Repeat after me. I have a headache.
I have a headache.
I feel tired.
I feel tired.
I have a stomachache.
I have a stomachache.
I'm feeling dizzy.
I'm feeling dizzy.
Perfect. Now, doctors often ask, how long have you had these symptoms?
That means they want to know how many days or weeks you have been feeling sick.
You can answer, I have had a headache for 2 days, or I have been feeling tired since yesterday.
Let's practice. Repeat after me. I have had a headache for 2 days.
I have had a headache for 2 days.
I have been feeling tired since yesterday.
I have been feeling tired since yesterday.
Great! Now, sometimes doctors ask, "Do you have any allergies?"
Allergies mean if you are allergic or have a bad reaction to medicines, food, or other things.
You can say, "Yes, I am allergic to penicillin," or "No, I don't have any allergies."
Repeat after me. I am allergic to penicillin.
I am allergic to penicillin.
I don't have any allergies.
I don't have any allergies.
Excellent. Another important question is, are you taking any medicine?
This means the doctor wants to know if you are already using any medicine.
You can say, yes, I am taking medicine for my blood pressure, or no, I am not taking any medicine.
Now, let's learn how to describe pain or symptoms.
Yes, you can say the pain is sharp or the pain is dull.
Or, "I feel a burning sensation," or "I feel numbness in my hand."
Repeat after me. The pain is sharp.
The pain is sharp.
I feel a burning sensation.
I feel a burning sensation.
I feel numbness in my hand.
I feel numbness in my hand.
Great! Doctors may also ask, do you have a fever?
Fever means your body temperature is higher than normal.
You can say, yes, I have a fever, or no, I don't have a fever.
Now, sometimes doctors ask about your family medical history.
That means they want to know if your family has any diseases like diabetes or heart problems.
You can say, "My father has diabetes," or "No one in my family has heart disease."
Repeat after me. My father has diabetes.
My father has diabetes.
No one in my family has heart disease.
No one in my family has heart disease.
Perfect. Finally, let's learn how to ask questions to the doctor.
Yes, you can ask, "What is the diagnosis?" or "What medicine should I take?"
Or, how long will it take to recover? And are there any side effects?
Repeat after me. What is the diagnosis?
What is the diagnosis?
What medicine should I take?
What medicine should I take?
How long will it take to recover?
How long will it take to recover?
Are there any side effects?
Are there any side effects?
Great job! Remember, speaking clearly and using simple sentences will help you communicate better with your doctor.
And don't be afraid to ask the doctor to repeat or explain if you don't understand.
That's right. It's your health, so it's important to be clear. Now that we've covered the basic questions and phrases, let's talk about some useful tips to help you feel more confident when talking to doctors.
Great idea, Sarah. One important tip is to speak slowly and clearly. Doctors are used to talking with people from different countries, so they will understand you better if you take your time.
Yes, and don't worry if you don't know a word. You can describe your symptoms using simple words or gestures.
For example, if you don't know the word nausea, you can say, I feel like I want to vomit, or my stomach feels bad.
Another tip is to bring a list of your symptoms and questions before your appointment. This helps you remember what to say and what to ask.
That's very helpful. You can write down things like when your symptoms started, how often they happen, and if anything makes them better or worse.
Also, if you're taking any medicine, bring the medicine bottles or a list of your medications. This helps the doctor understand your treatment.
Sometimes doctors use medical terms that are hard to understand. Don't be afraid to ask them to explain in simple words.
You can say, "Can you please explain that again?" Or, "I don't understand. Can you say it in a different way?"
And if you feel nervous, remember that doctors are there to help you. They want you to get better.
Exactly. Being honest and clear about your symptoms helps the doctor give you the best care.
Let's practice a short dialogue using these tips.
Okay, I'll be the patient and you be the doctor.
Sounds good.
Hello, doctor. I have been feeling tired and have a headache for 3 days.
I see. Do you have any other symptoms like fever or cough?
No fever, but I feel dizzy sometimes.
Have you taken any medicine?
Yes, I took some painkillers, but they didn't help much.
Thank you for telling me. I will do some tests to find out the cause.
How long will it take to get the results?
Usually, it takes 2 days. Meanwhile, rest and drink plenty of water.
Thank you, doctor.
You're welcome. If you have any questions, please ask.
That was helpful. Practicing conversations like this will make you more confident.
Absolutely. Keep practicing and don't be afraid to speak up when you visit the doctor.
Thanks for watching Dream Speak English. If you liked this video, please subscribe and share it with your friends.
And leave a comment telling us about your experience talking to doctors in English.
We love hearing from you.
See you next time.
Bye for now.